Ontario's acting auditor general has released his department's newest audit. It's a report card of sorts for the province, looking at value for money in 12 different areas. It's found plenty to take issue with, including the cost of relocating the Science Centre, how emergency rooms operate, and much more. The CBC's Megan Fitzpatrick joins us live from the Ontario Legislature. So, Megan, tell us more about the key findings in this report.
Well, there were quite a few topics related to healthcare in this province, and there was an entire audit on emergency departments in hospitals across this province, and it really shows, Andrew, the strain that they're under. The audit finding that there were more than 200 closures of emergency rooms over a one-year period, and it was saying just the severe shortage of nurses and doctors are contributing to those closures. Also, wait times in emergency departments still long in many instances, patients still getting treated in hallways in some cases. So a number of issues outlined there, but the Auditor General saying too that there is a lack of a strategy on the part of the provincial government to avoid these closures in the first place. Take a listen to what he said about that.
We identified the use of agency nurses is quite significant, especially in the north. And without having a strategy to help address that, I think it's significant. Other provinces have a strategy for northern hospitals. The community in the north is quite different than the community in the south. So without having a dedicated strategy for northern hospitals, I think that's something that the ministry needs to take a look at.
One of the audits was on Northern Ontario hospitals specifically, and the same finding, Andrew, about a lack of a strategy there to ensure that patients are getting timely access to care. And a common theme among all the audits related to healthcare in this annual report had to do with the use of agency nurses, nurses that work for staffing agencies. They're not permanent staff at hospitals. And he was outlining how much of a cost that is to hospitals, because often these nurses and these agencies are charging a much higher hourly rate than the staff nurses. One hospital, for example, the AG found spending more than $8 million in a year on these agency nurses. So he is calling for a strategy to address these staffing shortages. And one of the other key parts of this annual report had to do with the Ontario Science Centre and looking at its operation, as well as Science North, another science facility in Northern Ontario. But the Ontario Science Centre, particularly controversial lately because of the government's plan to shut it down and move it to Ontario Place. And last week, the government issued its own business case to support that decision, saying that it will save money in the long run to build a new one at Ontario Place as part of the overall redevelopment there, than to fix the existing one. Now, the Auditor General taking some issue with that business case that the government did and saying there's a lot of critical information missing from that analysis, that some relevant costs were not taken into consideration. And also the AG saying there wasn't enough consultation about this decision, including with key stakeholders like the City of Toronto, which owns the land that the current Science Centre is on. Not enough consultation with school groups and school boards. A lot of field trips go to the Science Centre. 25% of the guests are students. They weren't consulted enough either. So a few recommendations contained in that part of the report. Andrew, that was one that people were really looking forward to reading to see the comparison of what the AG found with that business case that was put out last week.
And so what's the reaction to the report so far?
Well, the infrastructure minister, Kinga Surma, who's in charge of the Ontario Science Centre and Ontario Place redevelopment, defended the government's decisions on both. But she was asked in a news conference just a few minutes ago, what about the lack of consultation on this major decision? Here was part of her answer.
What I would like to make clear to the public is that what's most important is that we provide a long-term sustainable solution. The AG in his report mentioned the operational challenges, the fact that exhibits haven't been updated in a number of years, the deferred backlog. Well, now we'll have a brand new Science Centre with new exhibits, more sustainable operationally for 50 years. I think that's an achievement.
Health Minister Sylvia Jones also at that news conference, Andrew, defending what her ministry is doing on the staffing shortages and saying the government's making lots of investments, but sometimes they take time to, sort of take effect. But she defended how the government's handling healthcare. The opposition party saying they're doing a poor job on it. They're letting the healthcare system deteriorate. They're being negligent, and that's putting patients, Ontarians' lives at risk.
Megan, thank you. The CBC's Megan Fitzpatrick live at the provincial legislature in Toronto.